In general physical examination, we start from introduction, then inspection, percussion, palpation, and auscultation if necessary. There are four important points to look for in GPE: pallor, jaundice, cyanosis, and clubbing. For these important points, we use the mnemonic PJC square. For pallor, we look in conjunctiva, face, palmar crease. We have to compare our hand with the patient's hand to look for the presence of paleness. Then comes jaundice. For jaundice, we look at sclera in daylight. The skin is prominently yellow in jaundice. Cyanosis means the blueness of skin, which can be due to low oxygen levels. It is of two types: peripheral cyanosis and central cyanosis. Peripheral cyanosis is present at the peripheries, including hands, feet, tip of the nose. Central cyanosis is present at lips, tongue, central region of the body due to low oxygen levels. Clubbing is present in the conditions such as bronchiectasis, infective endocarditis, etc. In this condition, spooning of nail is present. The sequence of the examination is as follows. We start from hands. For this purpose, we use the mnemonic from left to right. Hi, you late for no excuse. In hands, we check sweating, which is mostly present in hyperthyroidism. Also, for the dryness of skin, present in hypothyroidism. For pallor, present in anemia. Palmar erythema, which is also present in hyperthyroidism. In nails, we look for splinter hemorrhages, coal tar signs, leukonychia, chylonychia. And also, we compare both hands. For example, whenever there is a pair, always compare. The nodes, if present, such as Osler nodes, Hebernder nodes, Bouchard nodes. Look for any deformities such as Swanneck deformity, Z deformity, Botinier deformity. We'll advance towards upper limb, in which first look for radial pulse, and we do have to look for it in both limbs. Also for radio-radial delay. For pulse, we look for volume, character, rate, rhythm, and condition of the vessel wall. Now we'll advance towards face. In face, we first look at the hairline if it is normal or receding. Sometimes outer one third of the brows is missing, which mostly occurs in hypothyroidism. Then we look at the eyes. In conjunctiva, we look for anemia, and sclera, we look for jaundice. We also look for any sort of conjunctivitis, blepharitis present, and eyelid edema present. Then we look at the nose, we check nasal hygiene, any form of deformity present. We look at the color of lips if they are blue or not. Check for the angular stomatitis, which is mostly present in iron deficiency anemia. We'll ask the patient to protrude the tongue and look for the surface of the tongue. If it is smooth, then it is mostly diagnostic of glossitis. Sometimes there is yellowness present in the mucous membranes, which is indicative of jaundice. We also check the oral dental hygiene. Then we look at neck for lymph nodes. First, we palpate submental, submandibular, and then preauricular, postauricular lymph nodes. Also, occipital, look for the anterior cervical, posterior cervical, and supraclavicular lymph nodes. We also inspect neck for any sort of mass visible. Sometimes there is mass seen in the neck, such as in goiter. If the swelling is present, then give command to the patient to protrude the tongue. If the swelling moves upward, then it is thyroglossal cyst. Also, we look at the lymph nodes present at the axilla. There are five groups present in the axillary region. Five groups of lymph nodes are anterior, posterior, lateral, central, and apical. Then we look at the epitrochlear lymph nodes. After that, we do examine the inguinal lymph nodes. We look for sacral edema and then pedal edema, which is checked 2 cm above from the medial malleolus by pressing thumb for 2 to 3 seconds. In case of hypothyroidism, non-pitting edema is present and pedal edema is present in cases such as nephrotic syndrome, congestive cardiac failure, liver cirrhosis, etc.